we were in the swimming pool, and I always remember we were swimming along, and I just noticed very high on her chest there was something. I could see something through her swimsuit. I could see that there was something there, and I said, is that thing you were talking about? She said, oh, it's probably the same thing that I had when I was pregnant. When I had the fibroadenomas, it's probably the same thing as that. It's nothing to worry about. I don't want to stress anybody out. It's fine. And I said, fibroadenomas aren't really as common in postmenopausal women, and I was kind of saying, let's just get it checked.
With me in the studio is Tammy Strickland, and Tammy is a 30-year-old biomedical researcher from Dublin. Now, the story that Tammy is going to be telling us and talking to us about is a bit different to the other stories on this series of podcasts, and that the other stories have been personal experiences of cancer. The story that Tammy is going to tell us is about her mother and her mother's breast cancer. So we'll start and take it from there. So your mother passed away from cancer 3 years ago, is that right?
She did, unfortunately. So I suppose we might as well name her, will we?
Yeah, do please. Yeah.
So her name is Deirdre, but I mean, she had all sorts of nicknames. I suppose I would call her Mum, but you'd have Dee as well. She was a fantastic person, and she kind of ran into a bit of bad luck. She had the lobular cell cancer, so the second most common type of breast cancer affecting people.
And taking me back there, Tammy, so I suppose what made her look for possible signs of cancer in the first place? So bring it right back to there.
Maybe. Yeah, that's a great question. So, Mum's journey was a kind of an unusual one, I would say. Well, she met other women in similar experiences, but from my perspective, I remember Mum was someone who would always go to mammograms, and like she was always very on top of that, because I think from a young age she always had sort of fibroadenomas and things like that, cysts, but she was very on top of her health, because she knew health was super important, especially because her family was growing, and she wanted to make sure she was in the best shape. And
so she was very vigilant about going for routine checkups and going for mammograms and checking herself.
Oh, for sure, because when she was pregnant with me, she told me this. I was going to say I remember, but I don't, of course, because I wasn't born yet. Yeah. But she told me that when she was pregnant with me, she had a cyst in one of her breasts, and she had to have it removed once I was born. And she said that she remembers the surgeon saying, "Oh, your tissue is a bit unusual," and she was very worried because she was thinking, "Oh, I'm just after having a baby, and I have a 6-year-old child as well." And she always was vigilant because of that, because she knew that there was a lot at stake. So she always kind of, after that operation that she had to remove that tissue, she was always going for mammograms. It was.
And would she have talked to you about, ensuring that you were checking yourself? And
oh, absolutely, because like in my family, like mom. Kind of, to be honest, her cancer journey came out of left field. My dad has a history of melanoma, so he's had skin cancer multiple times. As a family, I suppose we were always really on the lookout for any sort of like cancer or abnormality.
Yeah, so on the radar. Yeah.
Oh, exactly, and that's where she always kind of encouraged us to look after ourselves too. But I remember when she was very active in her kind of later years. So she was in her 50s, and she was very social, and she would go out to all these kind of exercise classes and stuff. And I remember she was a little bit worried because she had found a kind of a hardness in her tissue on one side. And she was saying, okay, well, if there's something that's not quite right with this, they'll pick it up on the mammograms, surely. And she went for her routine mammogram. And when she left,
so what year was that?
Oh, that was about a year, maybe 18 months before she was diagnosed. So
okay.
she
so
went.
You're talking about back in
kind of. Oh, that's a good question.
2018, maybe. Or
yeah,
like that.
Exactly.
Yeah.
And she went for this mammogram, and she was very nervous, actually, waiting for the results to come out in the post.
Oh, sure.
Yes. And then when it came in the post, it said it was clear. And she went, oh, fantastic. And she actually told me that she was so relieved that she ripped up the letter and threw it all in the air, because she was like, thank God, because she really was worried about this.
So there had been a niggle in her head, thinking there's something not quite right here.
Exactly. And she was kind of thinking, okay, well, this has cleared me. But And then everything was fine. And like mom had some chronic illnesses as well. She was a little bit unfortunate. She had lupus actually as well, an autoimmune disease. So she had her aches and pains, but she never kind of noticed anything out of the ordinary in her world, you know. And I think when it kind of became apparent that something else might be going on was when Mum and I started going to some of those exercise classes together. And I remember one of them was in a pool, and we were in the swimming pool, and I always remember we were swimming along, and I just noticed very high on her chest there was something. I could see something through her swimsuit. I could see that there was something there, and I said, is that thing you were talking about? I said, oh yeah, it's fine. No, it's fine. And I was like, oh, I don't know about that, because I am from a biomedical background, and we had to study all sorts of cancers and in different contexts in my degrees. And now I was no expert, but I just had this feeling. I was like, I really think you should get that checked, because I knew myself that she said, oh, it's probably the same thing that I had when I was pregnant. You know, when I had the fibroadenomas, it's probably the same thing as that. It's nothing to worry about. I don't want to stress anybody out. It's fine. And I said, fibroadenomas aren't really as common in postmenopausal women. And I was kind of saying, let's just get it checked. Let's just go about it. And we went to the GP, and she got an emergency referral actually to the breast check clinic.
So the GP was concerned enough to give it an emergency referral?
He was very concerned. He was brilliant, but he was very concerned. And she was, within 2 weeks, she had her triple kind of check. She went in for her ultrasound and her biopsy and everything. And I had a really unfortunate, I did tell her this eventually, but I had a really bad feeling, because I remember they were checking a lot of her lymph nodes and taking biopsies from multiple places, not just the breast itself. And she was
Were you with her at the triple assessment?
I was. Oh yeah. It's funny, because Mum and I kind of kept this between us, because she didn't want to. She was kind of very much an Irish mammy. She didn't want to be causing any fuss. You know, don't worry about me, I'll be fine. But I said, no, we'll do this together, and we went together to the clinic, and we didn't even tell my dad actually for a while, because we were trying. He was going through a lot, and we just said, no, we'll go and sort this, and then we'll tell him afterwards. Be grand. And then we went. She had her biopsy and everything, and she went out arm swinging. And then we got the call to come in and get the results, and she was floored at the diagnosis, because
so the call to get the results, obviously she was told to bring somebody with her then at that point, was she?
Yes.
And again, were you her person there again?
Yes. But she didn't, again, she was so sure
that it was going to be nothing.
Yeah, because it was the same for her. It was, it's like that thing I had when I was 36 when she was pregnant with me. And so she had kind of assumed, it'll be grand. And I had this bad feeling just because of how it looked. And I noticed as well, when she was going to those exercise classes, she was getting very tired very quick. And my mum was an energetic person, and I always, even from young, I remember loving. She had big muscles, she had big biceps in particular. I always wanted those muscles. I was like, I want to look strong like mum. And she was getting very tired randomly. And I said, that's a bit strange, for mum. And she actually took to the bed one day, and this is before she even went in for the triple assessment. She didn't go to her exercise class. She stayed at home in bed, and she said her ribs were hurting her. And I said,
so
that's not right.
Yeah. So you definitely had cause for concern.
Oh yeah, it wasn't her usual, and
and when you sat down, then the day that she got the diagnosis, how did she react, and how was it explained to her and you both?
So I always remember her consultant was lovely. In fact, I remember on the way in, she kept saying, God, he's a very good looking man. She was like, she's funny. But he came in and he was very somber. He's a lovely man, actually. He was very kind to her. But I always remember, and there was a nurse as well who was really, really kind. And I remember seeing the nurse come out and call us both in. And she had this expression, and I don't think Mom clocked it, but I did. And I was like, oh no. And we sat down, and they said kind of, this is what the story is. We don't know what stage it is yet, because you're not only do you have a breast cancer, this cell type, lobular cell, it's also in your lymph nodes under your arm. So we need to go for more tests. And I remember looking at her, and her mouth just hung open. She was like, all right. She just didn't think that was...
So she really hadn't expected
no
this
idea.
At all?
Yeah. And I was just kind of sitting there taking it in, and...
And it was invasive lobular breast cancer.
Yes, which is, I was saying it earlier a little bit.
What is that?
It's the most common form of breast cancer is ductal carcinoma, and it's kind of lobular is different in that it affects a different part of the breast anatomy. It's the second most common, but it affects fewer women. So overall, I think it's something like 20% or less people are going to get lobular. It's very different in terms of how you treat it. Because the way it kind of works at the cellular level is a bit different to how ductal carcinoma works. And more drugs have been developed that really benefit kind of ductal carcinoma compared to lobular. And I suppose the other thing with lobular is that it's really hard to see it sometimes, and it looks different.
So it presents very differently.
Yes, and it's kind of it can be invasive and can spread quickly. And a lot of the time, people who have lobular, it takes them longer to go about it, to figure out, like, you know, is this something, or it could be at a higher grade or a higher stage by the time that it's actually found, because it's not the typical. It's not always just a lump, essentially. So, but Mom's was it was interesting because the tissue was so big. The primary tumour that she had was so big and so calcified. I remember they actually, when they were taking the biopsy, they nearly broke the needle, and she was laughing at them saying, "Oh, you can't get me," kind of a thing. But yeah, she had a quite an unusual tissue type, I would say. But at the same time, cancer, of course, is very diverse in how it presents. But lobular certainly is not the usual.
There's nothing generic about breast cancer.
No.
I mean, which is why there's targeted treatments rather than just, here, this is breast cancer treatment.
Exactly. No, it's never one size fits all.
Yeah.
And Mom was actually very lucky, because when she did start her treatment, she got a kind of a targeted enough therapy that had just been through clinical trials. So she was very lucky, and she did great on that first drug. So absolutely, like, lots of progress has been made.
So what was the treatment plan outlined to her?
Initially, when we found out the news with her consultant, he went and brought her for staging, and he initially thought it might have been stage 3, just based on the lymph nodes and the grade of kind of invasiveness. And then we went for staging, and of course we actually found out that she had stage 4, because it had spread to multiple places, multiple bones and some organs. And so the treatment is going to differ if you're stage 4 compared to, of course, if you're stage 3 or 2, because you're not necessarily trying to just treat the primary tumour at that stage. You're trying to prevent everything from...
So it's not just the type of cancer, it's the staging, obviously, as well.
Oh, of course. Yeah. It's so important, because, I think that the outlook changes. You're not trying to... Because she kept thinking, oh, are they going to remove something, or are they going to do a surgery? And it was kind of, no, once it was stage 4, you don't want to sort of interrupt the tumour too much. You kind of want to start chemotherapy or some sort of local therapy for that, but also widespread therapy, so like hormonal therapy. So she was on tamoxifen to try and inhibit the hormonal signaling, and a sort of a targeted drug to stop it from going anywhere else. And then she was on a drug as well for her bones, because she had a lot of metastasis or secondary tumours in her bones. So she was on a couple of things to try and keep the cancer where it was, prevent it getting worse. And to be honest, like the first while she did fantastic. Like she was absolutely flying it. But it was only when, and this is the unfortunate thing about cancer in general, is when the drugs are fantastic until they stop working,
And at what point did you know that the drugs had stopped working?
So she was about a year and a bit on the targeted therapy, which was called palbociclib. It was a like a cell cycle inhibitor. And she used that time wisely, to be fair. She went traveling, and she did all the things she wanted to do.
So how often would she have to get that treatment?
She would take a drug orally every day at home. Okay. So she didn't even have that sort of coming in for chemotherapy experience until about a year and a half into her journey. And I remember I actually moved to Galway to do a master's degree, and I wasn't sure whether to move, because I was afraid. I was like, I don't want to miss out on her appointments. And actually, I was commuting back and forth the whole time to go to her appointments. And I remember it was just after the Christmas exams, and when we found out that the drug had stopped working because some of her secondary tumours were getting a bit bigger, and we wanted to change course. And so after Christmas, then everything was kind of redesigned. Like we'll go for chemotherapy instead. And to be fair, she did respond well to that too, but it was more difficult, a bit of a shock, I would say, compared to taking a drug every day the way she would take her medications for, for lupus or for whatever.
Yeah, but now she was going in for rounds of chemotherapy.
It was a very different experience. And I think before she could almost forget that she was in that. She kind of forgot that she had breast cancer, because she hadn't had any surgery or radiation. She hadn't kind of sat in the ward, the day ward with all the other people there. So she kind of forgot, and she was very casual about it. And then it really hit her, I think, after that okay, this is the situation. And then she started, but she evolved, she adapted to this. I mean, she was a very positive person, and she weirdly enough, she actually enjoyed her time on the ward because she used to make everybody laugh. So that was, it was, I think, as I said, it was after that Christmas that it all changed. But yeah.
And what happened then after that?
So she switched over to Taxol, and now interestingly, Mom was a hairdresser when she was young, and this was the first time she was going to lose her hair.
Okay.
So this was a kind of a drug.
I mean, that was going to be a big deal for her, was it?
Yeah, but you know what? It was funny because in the end, she kind of went, I don't care. And luckily, she had a lovely head. So she had a lovely face. So it kind of suited her. But I always remember there was a woman that was extremely kind where she got her wig, because she got a wig. And she actually got the wig in a style that she couldn't actually get on herself. So she was like, well, I couldn't do it with my natural hair, and now I can do it with this is great. So she was again very upbeat, but the woman that did the styling was fantastic. She was super nice. She came to the house and everything to style it. But after that,
and that's really important, isn't it?
Oh my God, yeah, it gave her such a lift, because she felt good about herself, and not even just, I have cancer and I feel good. It was like, I actually look
so
great.
It's far from a vanity. I mean, I think getting yourself to feel good and to look, like the way you want to look, and the way you did look, I think is really important.
Oh, absolutely. I mean, because mom as well, she was sensitive about it in some ways, because she didn't want people to be asking questions, because she just wanted to get on with it. She wanted to go and like not dwell on things. That was just her way of going about it. And I think she knew that some people were looking at her differently, and she didn't want that. Some people were trying to ask her before she actually even had the chemotherapy that made her lose her hair. They were trying to figure out if she was wearing a wig, and trying to kind of sneak that question in, and then they try and notice if she'd lost weight or not, and things like that. And when by the end, she only wanted the people who were really the most involved with her, like her very best friends and myself and my dad and my sister, to actually see her, because she just didn't. Image matters, your self-image really matters, and she was an extremely stylish person, and and loved.
I think that's a really important message to get across, is because, as I say, I mean, it's a huge part of it.
Yes, it really, and it does change how you see yourself. And like, don't get me wrong, there were moments where sometimes she'd dress up and stuff going into appointments, and she'd feel really good. I remember she was going in for radiation therapy for like the second time, because it was complicated. She had to go back and forth for different things. And I remember she was really nervous going in the second time, and I found this scarf in a boutique, and it was gorgeous. It was so her, because my mom, as well as being a hairdresser, she was a painter, and it looked like one of her paintings. And I was like, oh, you know what? She's going to wear that. And she did. She wore it all the time, and she liked looking good. And that's where kind of towards the end of her journey, I felt she didn't really want people seeing her like that. And even when she passed away, she didn't really want people looking at her in a, and feeling sorry for her or something, or looking at her and not remembering her as she was, and but mind you, I always thought she looked great,
Yeah. And you actually, you put that very well. So once she had changed drugs again from the chemotherapy, how was she responding at that point?
Well, for a while, because you'd go and she'd go in every week, and then she'd have a week off, and then we'd kind of review every few months. And the Taxol seemed to really agree with her for some time. She actually, I meant to say this before, she wore a cooling cap to try and keep the hair.
And did that work?
It did for her for a while, but her hair did thin out a bit. And I actually think that she preferred to be bald, because it was kind of a yes or like a it's there or it's not. It's not the kind of, because she was worried, like I don't know. I think she just preferred having the either short spiky hair or no hair, rather than, because her hair when she had the cooling cap was kind of long and stringy. She's like, no, get rid of it. But
and again, I've heard that before. So I mean, I think for some the cooling cap does work.
Yeah.
But for others, I think it doesn't. And for some, it's kind of a mixture in the middle, and that doesn't work for anybody either. So I think it's for some people it is an all or nothing thing.
Yeah.
But obviously, it's a great innovation to have.
Oh, it's fantastic. It gives people options, absolutely. And I mean, and it did work for her for some time, but then she just kind of, but you know what? The other thing is, Mum was a person who, she never liked to stay still. She never liked things to stay the same. At home in our house, like, she'd be moving furniture the whole time, even when she was sick, or like regardless. So if she was looking at herself in the mirror, she'd be shaving it anyway, because she'd want to change,
Yeah.
So, it kind of, it made sense for her whenever she wanted to stop it and just have short.
Yeah.
It suited her then. She was fine. But eventually, because she tried different chemotherapies, and I think she changed in total about 3 times. The second chemotherapy, as in the one that I was speaking about, the Taxol, worked actually quite well for some time. And I think what was interesting about it got her used to the pattern of going in and sitting in the ward and getting to know the nurses and getting to know the doctors kind of more personally, and then getting to know everybody that was in for treatment. She got to know everybody. She made a lot of great friends. And I think even though she was going through a lot, because she was sick, of course, she enjoyed it. She kept saying like, she kept treating it like, I'm going in for my job on a Friday, because it was on Friday.
Yeah,
She's like, I'm going into my part-time job. And, she'd sit there for, the half a day, nearly the whole day sometimes, depending on her bloods and that. And she'd come back and she'd tell me all the stories of all the amazing people that she met and how she made this person laugh because she said this. It was funny because she took it all in her stride. She was never somebody to kind of go, it's terrible, it's terrible. She wouldn't want to almost go into those details. And I think that's just part of who she was,
Yeah, absolutely. Yeah. And that's fantastic. And it's fantastic that I suppose that she was able to have that communication with everybody else that was going through the treatment, especially if she was now, she responding less to other people, and that she didn't want everyone knowing her story, but these people were different.
Well, this is the thing. They were going through something tough as well. And I think this is the thing in this journey. It can be a very lonely journey.
Yeah.
And I think when you find your people, it's just like in any stage of any type of setting, it's always wonderful.
But I think, Tammy, I think it's really important to get across that it's a very personal journey, and that people, choose to walk it differently. So, some people, look for all the supports and, they're constant communication. Others aren't. And I think, you have to do what works for you. Yeah,
absolutely.
And because it is, at the end of the day, it doesn't matter how many people are travelling with you, it's the person who's going through it.
Yes.
That, it's their journey.
It's their journey, exactly. Yeah. Like cancer itself, which is just so complex. People are complex too, and what they want is very personal to them. So I totally agree. And it's funny because as we were going on, so I went to all Mom's appointments with her because, we were in it from the beginning. We were going to be in it to the end. That was just our way, because we were really, to be honest, my mum was my best friend. Like, we're very, very similar. And we always went into the appointments together, but I found I didn't want to crowd her out as time went on, because she had her people in there. And if I was sitting on the armchair beside her when she was getting her chemo,
she wasn't going to have the same conversation.
Yeah, and I was like, you know what? I think you're grand now. I'll hang back. I just wanted to go for the appointments to make sure that all the information was there. Because sometimes, and obviously this happens a lot when you're on chemotherapy, and to lots of people, you get a bit of brain fog, and you may not know what to ask. And I just wanted to be there to make sure she was getting all the information, in her doctor's appointments. But when she was going off with the nurses and her friends, it was like, I'll go home, it's grand,
And at what point, Tammy, did things change for the worse, and that you knew that things were not going to end well?
Well, I remember, it was never, being diagnosed with stage 4 is a scary thing, and it can mean...
And actually, and now that you've said that, I think you said earlier to me that, you felt she was questioned sometimes, that, how had it not been picked up before stage 4? So will you go into that a bit for me?
Of course, yeah. So it's funny because I always remember telling one of her closest friends and fabulous friend, who lived around the corner from us. And I remember going and telling her when she was diagnosed, just in general, when she was told that, you've breast cancer, you've this type of breast cancer. I remember going and talking to her friend and just saying, this is the story. And then she kept saying, sure, it's probably only stage 2, stage 3. And when she heard it was stage 4, she was angry and kind of not at Mam, but just in general, and kind of shocked. And everybody was very shocked around Mam. And Mam herself was kind of shocked, but also kind of like, it makes sense. And for me, I was angry that it had gotten that far, but it also made sense based on how she was feeling and the tiredness, and her bones were sore. Like, it made sense. But some people would get angry with her because it's like, why did you let it go on for that long before you got it checked? She's like, I did get it checked. I tried to get it checked. I went for my mammograms. I never missed them. I was always vigilant with my health. And then but it's like, it couldn't get through to them that she was looking after herself. And I don't know, she felt a great deal, I think, of shame about that, because she felt, because they would kind of feel, oh, well, what if we don't get much time with you? And it was a lot of emotion behind that. I mean, for both parties, don't get me wrong.
But isn't the message to get across there that, that was because of the density of the breast tissue?
Yes, yeah, that's so true. That's so true. So the thing with Mam, Mam was diagnosed age 59. So she was postmenopausal and she was going for her regular mammograms. However, the mammograms weren't really the best tool to maybe assess her particular type of breast. So there's a density issue when it comes to breast anatomy. And about half of women have either dense breasts or very dense breasts, and they're notoriously difficult to image with only a mammogram, because you can kind of miss things, and it's very difficult to see things. It's like looking through a kind of an opaque window or like one of those those frosted windows, rather than looking through like a very clear one. And so it wouldn't have mattered how many mammograms she got. Ultimately, it always would have been missed, in terms of like it wasn't the correct kind of way to assess her. She really needed a different type of imaging. And I think all women, to be honest, should really be aware of their personal breast density, to understand like what their risks are, and that if they feel that something isn't quite right, that they have the autonomy to go out and go to their GP and ask for a referral, because currently that's not what the situation is. You're either you go for your, and don't get me wrong, mammograms, so important, saves countless lives. However, there are some people that benefit more than others. And for the people that it's difficult to read those mammograms, we need to do more to support those people, or at least make them aware that they have a certain risk factor, so they have the power to look after themselves if they're concerned. But unfortunately, Mam was one of the people that had this very dense breast tissue, and it was impossible to see what was going on. But I mean, even on her last mammogram, she still felt pain on that side. She knew there was something there, and she thought getting a clear result meant you're grand. And what I would say to other people going through this is, no matter if you get a clear result, if something feels weird, just get it looked at. Even if you had fibroadenomas when you were young and you have a history of that, personal history of that, always go about it. Always trust your gut. Because it, like, don't get me wrong, absolutely wasn't her fault. It was a structural problem. She should have been referred for an ultrasound. But always go about it. It's never dramatic.
That's such an important message to get across, because again, I think a lot of women are very reliant on the routine mammogram.
Yeah.
And look, they may be checking, but I think it's really important to get across that it is the checking that's the most important thing, and you should know your own body and know your own breasts, so that if there are any changes, they're flagged immediately with you, and you go and you pursue it.
Yes, exactly. It's kind of trying to hand that power back to people about their bodies.
Because again, mammograms are fantastic.
Yes,
but I think maybe you can overly rely on the idea that, oh look, I'm fine. I've had my routine mammogram.
Exactly.
And clearly that isn't the case, and that's why the story about your mother is really important, because she'd sailed through the routine mammogram.
Exactly. And I remember even when they told her that she had breast cancer, she's like, oh, but the mammogram before had been clear. And she'd only gone kind of a year, maybe 18 months before. And the thing is, the primary tumour had already started building at that point, because she felt it was, she felt it, She
felt it, yeah. Which is why she was so relieved when she got the letter, because she did herself feel there was something there.
Yeah, exactly. And so it was bad luck. But at the same time, I do think it should inform change in how we deal with women with dense breasts.
100%, because dense breast tissue is an issue.
Oh, absolutely. Especially, in postmenopausal women. So women, or even just women over the age of 40, almost half of women have dense breasts or extreme. That's huge.
And maybe there are other markers that could be looked at.
Oh, absolutely. Absolutely.
Again.
I mean, for me, what would have really helped with Mam's case is that if they had kind of accepted, okay, she's quite dense breasts, we're not getting an entirely clear picture, maybe we just send her for an ultrasound to be sure. It's that extra step that would have been really, really helpful and may have meant a different stage for her that would have prolonged her life or saved her life. We don't know.
Yeah.
And it was always desperately sad knowing that.
Yeah,
and made me very angry, actually.
Yeah.
And this is why I tell her story. And also because I know Mom didn't really want to say all of this, because she still felt that guilt of people saying, oh, why did you leave it so long? She was just so overwhelmed by that. She's like, I tried, you know.
Yeah. So look, I think getting that message out there, you're speaking on her behalf. She can't speak now to that, but you speak on her behalf. And for any woman who's listening to that, I think that's an amazingly important message to get out there. And Tammy, so at what point then did you know that you were going to lose her? I mean, how did it all unfold?
So interestingly, the timeline of all this kind of coincides with COVID. So we had an unusual sort of journey in all of this because we went through several lockdowns and there were ups and downs associated with that. I mean, Mum and I got to spend even more time together, which was fantastic because we ended up, as many people did, making lots of banana bread and then binging loads of things on Netflix, staying up to all hours. Like, we had a great time. She got a little bit of a break from chemo, actually, because where she was attending for chemotherapy didn't allow anybody in because of COVID. So she had a break, which meant she had a little bit more energy, which was fantastic. And then because she had a chemo break, she was actually able to get her hip replaced. So this is one of her main secondary tumours was on a really inflamed spot in her hip. And it was actually kind of like slowly, she was getting slower and slower at walking. She was in an awful lot of pain. And then they decided, okay, well, because when she was on chemotherapy, she couldn't do anything because she wasn't it wasn't the right fit to have such a serious operation when she was on these medications. And then because she was off them for a prolonged period during the first lockdown, they said, okay, why don't we just, as a palliative kind of effort, why don't we replace that hip and get you back at least, on your feet and in her garden. Her garden was her place, was one of her great places that she loved. And she was delighted. I remember when she got it was such a weird thing. It's like somebody getting a call to say that they won the lottery. She got the call to say she's getting her hip replaced, and she's like, oh my God. Because she was like, I can go outside again, because she was in so much pain. And then she was really looking forward to it. I remember when she went in for the hip replacement, she felt like a celebrity because she was the first person to get an operation since the lockdown because of COVID in the hospital.
Wow.
And, so she was treated like a VIP. Like, there was nobody around. It was so funny. And I remember she called me before she went down for the surgery, and then she called me when she was coming around. This was funny, actually. When she came around from the anaesthetic, she rang me as well, and she was laughing. Oh, that's Mom. But that time was difficult for her in a way, but we ended up spending more time together making her recover because there was no services during COVID for physiotherapy out in the community. So then
we were doing her physiotherapy.
So we had to do these exercise routines together, and she's like, I don't want to do it. I don't want to do it. I'm like, you have to do it. If you want to get in that garden, you're going to have to do it. And so we were working on that every day. And it kind of gave us a bit of a routine together because, we knew that she'd be up at a certain time. Because I think the horrible thing about COVID, it was so random. And so your life structure was sort of gone. You didn't really know what to be doing with yourself. Whereas Mum and I had our routine and we had a goal to work towards, especially getting out in the garden again. And of course, she was trying to take shortcuts and it's just typical her. But she did get out again and she had a great deal of energy during that time. Like, I remember that summer was great. She was out in the gardens, getting a bit of sun and it's fab. And this is the funny thing because people were thinking, oh, it must have been very terrible during COVID. And in many ways, yeah, it kind of was, but there were a lot of good moments as well.
So that would have been the summer of 2020, so would it?
Yes. Yeah. And then kind of moving then throughout the year, she changed chemotherapies again because things were getting worse again. When I was actually during my master's, she had a random episode where, and this had been the year before, she had a random episode where they realized that she had some secondary tumors that were spreading to kind of like around her skull and that were pressing in on parts of her brain. And so she needed to go for radiotherapy, and that helped a lot. But then that happened again during lockdown where she had to go for more radiation on her head. And that was when things started to feel, this isn't going great.
Yeah.
And I remember.
And do you think she knew it wasn't going great?
Yes, and she would say these kind of profound things. That Christmas before, because she died in 2021 in April, and on that Christmas beforehand in 2020, there was a vibe, and she kept saying it. I think this might be my last one. And then, but so like we were trying to make it extras kind of special and fun, and she had a great time. She was very tired, but there was a knowledge within her. I think she knew her own body. She kind of just knew. And after Christmas, she started getting these skin lumps that were kind of not a great sign. And she, I had read about this before, and I had a bad feeling about it. But the GP was very kind and was saying, just see what time you have, and just live every day as you, as she, keep her happy essentially, and just appreciate her while you have her. And it was funny because I was very much of that mindset. My dad was very much of, how much time do we have? He wanted a number. My sister had, I think she thought that it wasn't as bad as what everyone was saying, or hoping that it wasn't as bad as what everyone was saying. But I had this feeling that it wasn't going great, because I knew Mom inside out, and I knew when she'd feel sort of like, oh, this isn't great. And so, but I wasn't acknowledging it, because I was like, I need to go by what the GP is saying, which is to, appreciate every day that you have her. And I always remember her birthday is in March, so it's the 20th of March. And I always remember she got annoyed at me because I was late. I was late. We were going to do something at home for her, and I was late because I was buying her. Her diet changed a lot. She had lost a lot of weight. She was never a sweet tooth, but then suddenly she was going mad for sugary things on the second type of chemotherapy. So I went and I was trying to find her something for a birthday cake, and I saw this huge thing of strawberries in Dunnes Stores when I was out. And I brought them home, and I was like, I'm late because of this. And she was annoyed at me. And the reason she was annoyed with me, because she knew it was her last birthday and she wanted every minute together. And that's why it was hard, because she just knew. And during those kind of between January and April, she was admitted several times to the hospital because she was having issues with, different kind of medical issues associated with side effects of the chemo. And it was kind of hard because I think her consultant was fantastic. He's a lovely person, but I think his real main focus was about trying to stop the cancer from getting bigger or getting, going.
So she was still having chemotherapy.
She was still having chemo, and I think she would have been better off to stop, because it was making her really miserable. And I think that was a conversation that should have really been had, because it wasn't really. He just kept saying, "Well, push another drug, thinking, I think maybe he thought that she was stronger than she was, because she was very outwardly very happy still and looked relatively good. But I think she probably could have done with another break from chemotherapy, and just to enjoy things rather than being, because she was quite sick in those months. That second chemotherapy didn't agree with her as much as the first one. So yeah, it was very tough. And I think the toughest thing actually as a family was when she was admitted to the hospital. We were still in the midst of a pandemic, and we couldn't go in with her, and we couldn't visit her. So that was terrible, because you were missing, you'd missing her for a week, and you wanted to be with her, and especially me, because I'm not nosy, but I wanted to know the what's on the chart and what's on because of the biomedical stuff. I wanted to know what was happening, and you couldn't.
You wanted to know what's happening, and also your instinct was telling you that
yes, this
time is getting shorter.
Yes, and I wanted to be able to sort of talk to, who was looking after, and you couldn't, because they were doing. It wasn't their optimal choice, I would say, because they were doing their best in a very odd time, a moment, I suppose, in healthcare.
Yeah.
But she was she would get doctors visiting her and telling her what was going on, and we wouldn't be there. I wouldn't be there. And then it was kind of, again, I always imagine it was a very lonely time for her, because in March, when she was admitted after her birthday again, they told her that she was going to die, and she was alone. They told her that and I really wish.
Now again, I suppose that was COVID.
It was because of COVID. Yeah. That's where COVID is very cruel in many ways.
Very cruel.
Because I would have, having been there when they told her that she had cancer and what stage it was, I would really wish that I even was, not that, I mean, because it's a horrendous thing to hear in any case, but you didn't want her to be alone.
And how did she relay that to you?
She couldn't, because her speech started to go, and she didn't know how to text it, because her bodily functions were slowly shutting down, and so she didn't know how to communicate it with us. And so there's a palliative nurse, he was a lovely guy, he rang Dad and I and explained, and
explained that she'd already been told as well.
Yeah. And we couldn't.
It's very tough, Tammy.
It was extremely tough. And we were actually, as a kind of a kindness by the hospital, they brought us into a place in the ward that's like a family room, which was unusual because of COVID, and they brought her in. You were all masked up and everything, and she had declined a lot, which was actually quite shocking, because she'd gone in the week before and she was herself, and then when they brought her out, it was very clear that things had kind of gone wrong, but at the same time, because I think her vision wasn't the best, and I went up and I kind of sat nearly on her lap and doctor probably thought I was weird, but I kind of was, and she saw me and she was like, and we didn't ever speak directly about it, because I knew she wasn't the type to dwell on I'm going to die, or she wouldn't want that pain in me, or it just wasn't her.
So that wasn't a conversation that was going to happen.
No. And so it was a tough one. It was more, my dad was the talker about that kind of stuff, and he kept trying to ask her questions, and she just didn't really want to go there. She just wanted to sort of, for it all to just stop being so stressful, I think, a little bit, because they transferred her then over to the hospice, and they thought that she would be there for some time. I think they thought she maybe had a month, but she died within a week. So no, it was tough. And I think the other thing is,
and were you there?
I was there, and which again is, it was a funny thing. It's never something that you actively want, but I'm so glad that I was there. And it was interesting because, I mean, the hospice is the people who work there are just superheroes. They're just, I don't know how they do their work. They're amazing people. But the hospice itself was very, very supportive, even though they didn't get to know her the way I would have loved them to get to know her, the nurses.
Because she was only there the week. So
and they didn't really get to speak to her, because she would have had some fun with these women. It was funny because they saw her, that scarf that I bought her when she was getting radiation, she had that was, on her bed, and they were like talking about who she was. And I was showing her paintings to them, and they were like, God, we really wish we could get to know her more, because by that time she was on a lot of pain medications to mind her while she was going through all of this. And so she couldn't really kind of talk much, which is a shame, because Mum was very chatty, which I think I have inherited. But yeah, it was a sad kind of end to it all. But funny, during that time there was this radio station that was on, and it kept playing. Mum had this song for me that was always, Tina Turner.
Yeah.
Simply the Best.
Simply the Best.
That came on about 5 times during the night when she died. And I was like, Jesus, I think she's trying to talk to me. Because it's funny, she didn't really respond to much, but I remember putting like a headphone. Always, I think, if anybody is ever, with someone who's either dying or, you're not sure of their consciousness, put their favorite song on in their ear. And she actually woke up and did a little dance and everything, and that came on several times during the night. So I feel like, even though it was terribly sad, it was beautiful too. And I think the hospice, as I say, is a very supportive and wonderful place. And they were very, very kind to us and to her. And I think, I just hope that people who are where Mom is, or where she was, that they always have the opportunity to die in those really lovely, kind, supportive place like that. I think everyone should be able to have that opportunity, and not everyone does.
Yeah.
But yeah, absolutely.
So what, having gone through that, and it's horrendous. But what is the message that you would like to get out there to any woman who's watching or listening to this podcast, in relation to themselves or a member of their family, their mother or their sister or, or their aunt or anybody?
Yeah. I mean, the first one, and we did cover this a lot earlier, is just always trust your instincts with your own body. You know your body more than anyone else. And have a look at breast density, especially if you're over the age of 40. Definitely look into all your risk factors. Make the decision for yourself. Take charge over your own health. That's number one. For people who are going through kind of what Mam was going through, I mean, I can really only speak to, from my own experience, because I was a very close family member, and it was extremely tough for me, even though I didn't always want to acknowledge that, because it was her journey after, it was her body this was all happening to, but it was quite tough for us all that loved her, and for me in particular, just because I was going to all of these appointments and hearing all these terrible things about what was happening. And I think it's for family members, I would say give yourself a bit of a break. I don't think I did that enough, and just be kind to yourself. In addition to kind of allowing the person who's sick to let you know what they need. Don't kind of
don't foist it upon them. So
exactly.
Let them tell you what they want rather than you
exactly
constantly being on them.
Exactly.
I think unfortunately the thing is, because people are good and they want to support, they want to feel part of it, they can maybe overdo it on that end of it as well.
They have the best of intentions, but of course everyone is different, and some people maybe do.
I think you need to give people a bit of space as well, And I think in particular, I mean, what I've got from these podcasts is that, I think when people are very tired after a treatment, that's not the time to be ringing them, or
no.
I think a text might be a kinder way to communicate.
Oh, absolutely.
You don't have to respond to a text.
Oh, absolutely.
But you may not. A phone call might be the last thing you want.
Exactly, and it's funny because I think Mom's best friends really understood that, and they all were aware, especially when she was going through chemotherapy, like what the schedule was and when not to be sort of on her with calls and things. But what was nice was that she had one friend that was sending her Mom, she was unique, everyone is unique, but she had a lot of a great sense of humor. So instead of sort of sending loads of how are you and what did they say and blah blah blah, it was more sending a funny video or something that they knew would perk her up. And
that didn't require a response, really.
No, of course, no, not at all. And that really helped. And that's a way of acknowledging that you're aware, you're thinking of that person. And again, Mom was unique and loved laughing and loved the bright things, and I think that for her that was extremely important. One of her best friends actually was fantastic. And again, she seemed to get what Mom needed, because they're very similar. So I think it's almost like she kind of just clocked it based on what she would want. I remember her last time seeing Mom was about 3 months before Mom, or 4 months before Mom died, because we were still in lockdown and she couldn't really see people. And to be honest, as I said before, Mom was kind of relieved because she didn't want people kind of looking at her like, oh God, you've lost weight. Oh, look, where's your hair? Kind of a thing. How are things going? And she just didn't want to answer those questions. But this friend would not care about that. And I remember it was during a lockdown and she sort of broke all the rules. Don't want to get her in trouble, I won't name her. But she came to the house and just knocked on the door and said, come on, get in the car. And she had packed a picnic and picnic chairs and a thermos of teas and coffees. And she's a brilliant picnic woman. She always has everything in the boot of her car. It's hilarious. But she took her to this park they used to go to the whole time, and they sat in a forest part of the park, and they sat a bit apart so that in case she would pass something to Mom, because Mom was very immunocompromised because of the chemotherapy, and they just sat there laughing for hours and people watching. And it required, literally, it was the most beautiful thing. And the funny thing is, when Mom was dying, I said to her friend, I said, do you want to come in and see her in the hospice? And she's like, I don't want to sound bad, but I want to remember that rather than remembering this part. And I think she would want that too. And,
Yes.
you know,
So from her end, she didn't want to take that memory with her, but she also was conscious that your mother wouldn't have liked to be seen like that.
Exactly.
So, you know, and I think you have to be very cognizant of that as well. It's not, you know, about what you want. It's about what the person who's going through it might want, you know, a need or not want.
Yeah.
Tammy, I have to say, it's such an emotive story to tell because, you know, that there's huge loss at the end of it. And the great thing, I suppose, is that for the majority of women, outcomes are really good now with breast cancer. So, you know, I think 85% of women, you know, will have a very positive outcome from breast cancer, and it won't end like it did for your mum, unfortunately.
Yes, yeah.
But I suppose the message, though, to take out of it is that not to sit back and be reliant on mammograms, but just to make sure that you still stay hypervigilant yourself about your own checking, that you know your body, and if there is a change, you pursue it and you continue to pursue it until you're happy with what you're being told, for good or for bad.
Absolutely. And ask if you get the result of your mammogram, ask for your breast density. Like when you get the results, you can ask. Yeah, you should ask, because at least then you're aware of all of the risk factors. Yeah. Because, you know, you get a list of there's some great information leaflets, patient information leaflets about all your risk factors, and breast density is actually listed as one. But how are you supposed to know what you have until
that's a great thing. Even if people just took that, ask what your breast density is, because you'll know then if it's a high breast density. Yeah. You just need to be more careful, because you can't rely on the markers maybe that other people could rely on.
Exactly. So hopefully I would love if women took that away from all of this.
I think it's a really important message. And again, you know, I'm sorry for putting you through having to go through that story, because, you know, it's obviously very difficult, and I can see how much you adored her, and you know, how close you are, and, you know, and I'm very sorry about the loss of your mum, but thank you for sharing that with me and with everyone who's listening and watching this.
Oh, not at all. If I get a chance to talk about Mum, I'll be talking for hours. She's an absolutely fantastic woman. So yeah, no worries.
Thank you, Tammy.
Thank you.